I'll be talking about fever in ICU, the non-infectious causes, which is extremely important in ICU, as we deal with a fair number of non-infectious causes of fever. So the topics that I would be covering is definition, pathogenesis, and the temperature, bit about temperature recording, and the list of non-infectious causes. There are about 17 causes, and drug fever, adrenal insufficiency, thyroid storm, diagnostic approach to the non-infectious causes of fever, management and role of antipyretics, and take-home message. So what's the definition of fever, which is defined in this particular journal? So it is a complex physiological response to the disease which leads to cytokine production, and that leads to fever and production of acute phase reactants. Along with it, there is activation of endocrine and immunological processes in the body, and together this would define as fever. So it is a complex physiological response to the disease manifested by extensive cytokine production leading to rise in temperature, acute phase reactant production, along with activation of endocrine and immunological processes. So, what is the pathogenesis of fever? So, when there is exposure to endotoxin, viruses, or staph aureus, so the lymphocytes get activated and they produce interleukin 1, interleukin 6, and tumor necrosis factor alpha. And what this leads to is signal transduction by the vascular endothelium, and that leads to increased production of COX2 and prostaglandin E2, and this leads to reduced firing of heat sensitive neurons, and this leads to either decreased heat loss or increased heat production, and together this causes fever. So that's in essence the pathogenesis of fever. So the normal temperature that is recorded is 37 degree or 98.6 degree Fahrenheit. So the American Association of Critical Care Medicine, or IDSA, defines fever as temperature more than or equal to 38.3 degrees centigrade or 101 degree Fahrenheit. And the temperature measurement, I think what we need to understand is either we could do peripheral recording of the temperature or core temperature that would be recorded. So the core temperature is recorded with the help of PA catheter, or you could simply measure the vesicle temperature or the rectal temperature. I think these three constitute the core temperature measurement. The peripheral temperature, you could measure it by oral temperature or axillary or by the tympanic recording of the temperature.